How do we diagnose asthma? So the most important thing is the symptoms with which a person comes. So a person with asthma is nothing but allergy of the lungs, very simply said. So they usually have cough, production of phlegm, difficulty in breathing, sense of heaviness in the chest heaviness, or wheezing. So whenever the person breathes out, you can hear a whistling sound sometimes. So these are the common symptoms with which a person with asthma come. Everybody need not have all the symptoms. Some people can have only cough, some people can have only breathlessness, some people can have only wheezing, some can have combination of both. The thing about asthma is that usually they are variable symptoms, in the sense they have good days and bad days. Some days you have more symptoms, some days you have less symptoms. Second thing is the symptoms are triggered by certain things. This is very important. So when a person says that usually when I go to the dust, it is more. When I get exposed to a strong smell, the symptoms are more. When I go into cold air or when I go into the ACs, it is more. Or when you have pets in the house, it is more. So this is called as triggers. So the symptoms are provoked by triggers. So asthma is predominantly a clinical diagnosis. So you talk to the person, you understand the symptoms, and then you come to a diagnosis. So why do we do the tests? Still, sometimes we order some tests to confirm the diagnosis, or to more often to rule out other diseases. So whenever a person comes with these symptoms, cough, phlegm, difficulty in breathing, heaviness of the chest, or wheezing, normally we order 2 or 3 tests. One is an X-ray, chest X-ray. Why do we do chest X-ray? Not because you find something abnormal. Most asthmatics have a normal chest X-ray. So if an X-ray is normal, it doesn't rule out asthma. X-ray is done to rule out other diseases. In India, TB is very common. If a person is coughing for more than 2 weeks, you have to get an X-ray just to see if you're not missing on other diseases. Second thing which we do is what we call as a lung function testing, pulmonary function test, or a spirometry, where a person has to blow into a machine and it will give the lung function of the person. And we also look at certain things called as reversibility in the lung function test. These are and also some blood tests. Asthma is nothing but allergy of the lungs, very simply said, as I have said. So you can also do some tests like eosinophil count or IgE levels to also look at how severe the disease is in asthmatics. So just to sum up, the diagnosis is mainly based upon the symptoms. Tests can be done are the X-ray, the lung function testing, and certain blood tests to rule out other diseases and just to confirm our diagnosis.